Together, we work as one for better LGBTIQ lives. Outright.
Advisor, Special Projects Asia. With me today are colleagues and friends from the Asia LGBTIQ Network on SOGIE and gender-based violence. And this is an LGBTIQ-led feminist and intersectional regional platform for expertise on gender-based violence in South Asia, Southeast Asia, and Northeast Asia. So with me today, Eka Tan Lane, who is joining us from Indonesia, where she works at the Indonesian National Commission on Human Rights. Jean Chong joins us from Singapore and is co-founder of Sayoni Singapore, a queer women's organization. And Rituparna Bora, who joins us from Delhi, India, and is co-director of Nazaria, a queer feminist resource group. Please read the more detailed speaker bios on the OutSummit webpage. And I will provide a link in the chat for the Asia LGBTIQ network on SOGIE and gender-based violence so that you can get to know about the network. All of us on this panel have many years of activism in different movements to stop violence rooted in patriarchy, which includes violence against LGBTIQ people. So our panel will be a frank discussion on centering wellness for sustainability of activism, on preventing and protecting LGBTIQ people from gender-based violence. In 2021, Outright and the Asia LGBTIQ Network collaborated in a study that looked at mental health stresses for activists in Asia working on gender-based violence. And I will provide a link in the chat to this study so that you can have a look at the findings. So let's start off this conversation. Ritu, Eka, and Jean, could you please take 1 minute to share your definition of wellness and well-being in the context of your work as activists working on gender-based violence?
Yeah, thank you so much, Grace. And to start off immediately about well-being and wellness, because well-being is mostly seen as the absence of disease, but it's not. It is a combination of a person's physical, mental, emotional, and various social health factors. And health is intrinsically linked with gender-based violence. And well-being is also linked to being happy and satisfied in life. And it, in short, it means that how you feel about yourself and your life, but it's not about your life alone. You are only not responsible of your life. So it's about how the ecosystem treats you. It's about how the system treats you. It's about how the laws and the institution treats you. And if there's gender-based violence, then your mental well-being or your mental wellness can go haywire. And that's what mental well-being. And it's how it's linked to gender-based violence. Yeah, thank you so much.
Thank you, Ritu. Jean?
I don't have such a comprehensive answer. My definition is self-preservation, and also I see mental health well-being as how to be an effective activist, because I've said this quite a lot of times without mental well-being and self-care. So the chances of us taking a lot of risky decisions or misjudge situation is very high. So immediately our risk profile goes up and our anxiety goes up. So that's why I see it as a survival thing. We have to do it.
Okay, so you're saying that wellness is necessary as part of making good decisions in the work that we do as activists. Huh?
Yes.
Okay. Eka.
Ya, untuk kesehatan kita selalu mendefinisikannya atau mengartikannya dari 3 aspek. Ada secara fisik, kemudian secara psikis, dan juga tentu secara sosial. Nah, permasalahan adalah ketika kita berbicara tentang kesehatan sosial, di mana ini sangat susah sekali untuk dicapai karena masih ada diskriminasi, stigma, terutama kepada kelompok minoritas dan sebagainya. Sedangkan untuk kesejahteraan, kita berbicara di mana kita merasa dalam hidup kita sudah merasa penuh, merasa bahagia, kemudian merasa tujuan dari hidup kita itu sudah terpenuhi. Kita sudah dalam on track yang menjadi tujuan dari kehidupan kita. Seperti itu, Grace.
Thank you. So working under COVID-19 conditions must have been a tremendous challenge for all of you, especially as we have read all of the studies in many countries. There were spikes, increases in family violence and intimate partnership violence across the board, and also in LGBTIQ communities. And there were limited resources to deal with these crises faced by LGBTIQ people. So could you take 2 minutes each to highlight some of the very dramatic, stark challenges that you faced in your work during the pandemic and how these challenges impacted your mental health and well-being as activists? Ritu, you want to jump in?
Yes. So basically, COVID-19 was very difficult for us. I am going to talk like 1 minute about the community because the community was locked in the home. The community did not have access to resources and even simple things like, having to wear what they want to wear for trans persons, for example, being used dead names, or lesbian women were forced to marry during this time, forced to see grooms during this time. There was conversion therapy everywhere. There was corrective rape everywhere. For us as human rights defender, one of the things that we face is that, gender-based violence was not regarded as essential services. The services that we gave under gender-based violence was not regarded as essential services. Only services for COVID was regarded as essential services. I think that was a mental health stressor. The second was closing of borders, because Delhi is a state where various people from smaller towns and towns and B towns come. The closing of the borders made it very, very difficult for us to do rescues, and that put us a lot of burden. Thirdly was that our peer counseling, we ran a peer counseling helpline. Because of the community did not get enough support from home, we had to keep the peer counseling helpline on even on Saturdays and for more hours. That actually increased a lot of our burden, and the cases also increased during that time. The helpline calls also increased, almost doubled during COVID. I think these are some of the mental health stressors that we as activists faced.
Okay, Eka?
Iya, selama pandemi tentu saja kita mengalami Zoom fatigue karena kita kadang Zoom tidak hanya selama jam kerja, tapi di luar jam kerja. Kemudian kekhawatiran yang lain adalah beberapa stakeholder, terutama dari aparatur pemerintah, itu mereka tidak ingin melakukan kegiatan secara online. Jadi kita tetap harus mengadakan kegiatan secara offline, di mana kita sendiri khawatir akan terkena COVID-19 ya. Kemudian kita juga khawatir selain dengan pekerjaan, pada waktu itu aku juga sedang menyelesaikan atau menempuh studi magister, kemudian antara pekerjaan, studi, dan juga orang tuaku tinggal jauh dari aku, jadi aku juga terpikirkan mereka setiap hari. Ini membuat semuanya tumpuk, membuat stres, membuat burnout dengan kondisi seperti ini, dan kekhawatiran terjangkit, kemudian nanti mati dan sebagainya, itu tuh ada kurang lebih selama sampai beberapa bulan ya, sehingga membuat aku susah tidur bahkan sampai terkena sakit. Itu yang terjadi pada waktu awal-awal pandemi seperti itu.
Oh, Grace disappeared. Maybe I can answer next.
Yes.
I'll take over. Just kidding. Well, I'll talk about Singapore. So when COVID was happening, oh, you came back. So
Sorry, I had somebody at the door. Oh my goodness.
we're like, oh, maybe it's time for us to run while the cat is away. Well, it's my turn to share. I was just talking about when COVID was happening in Singapore. I think a lot of LGBT groups were responding in a way that only they took care of their own constituency. So the different identity groups only kind of just trying to roll out assistance to their own group. So, but our response was the very first thing we did was to do a rapid survey of the community to see the entire community, what are some of the challenges they face. So one of the key things about gender-based violence is that we found 60 to 70% of the respondents talk about being stuck at home with their abusers, which is very often our families. So about 60 to 70%, and because they're locked in, they couldn't escape. So after we got the statistics, the very next thing we start to fundraise so we could take care of the entire LGBT community, including residents in Singapore, because we have a huge population of people that are not Singaporeans. They are also stuck here as well. So we want to take an intersectional approach to take care of them. We provided 8 months of COVID relief over 5 times actually, which provided counseling, support group, cash vouchers, food vouchers, and so on and so forth. So it ran for a long time. But the big question for us when I was running it for 8 months during COVID, we took care of others, but who takes care of us, right? It's about self-care question. So, but in that 8 months, it was like having a full-time job. We not only have to deal with meeting up people because of the health risks. There was no vaccines that time, so there's an element of the risk. The second thing that we had to deal with was abuse. Actually, people who did not get the support from us because we only have so much money and we have to choose the most people that are the most affected, and we get abused by people who didn't get it. And very often the people who abuse us are cisgendered gay men. So I just want to call that out. And they are the main abusers. And a lot of times they do have a job, just that their salaries are very much reduced. So, so the other thing that I often talk about is how COVID amplifies some of our existing issues in the community. We found that the different identity groups respond to help quite differently. Very often, gay men they are more comfortable applying for support. Then the lesbians, the trans men, and trans women often do not respond the way that the rest did, and as well as elderly people, they don't have computers, and we had to change the way we reach out to them by word of mouth, through their own community groups, because they don't have laptops, right? They have handphones. So, and very often they told us that having the COVID relief was a relief for them. They're happy to have it because before COVID there was nothing for them. So the existing problem is way deeper than what COVID created. So what happens when the relief is gone? So that's the other layer of stresses that we face.
Thanks, Jean. Yes, so COVID exacerbated and really threw up for everybody, for the world to see how not only things were during COVID, but pre-COVID. So that's an excellent point. Thanks for bringing that up. So in the study that I mentioned earlier that Outright and the network collaborated on, participating activists, and you all participated, all of you participated in that study with 27 other activists from 6 countries were participating in that study. So the people who took part in the study said that those who were working under conservative governments they felt that a significant contributing factor for mental health stresses for activists was that they themselves had to deal with the stigma and marginalization which was the same as the people that they were trying to help. They also said that, some of them also said that they face hostilities when they were intervening in violence against LGBTIQ people. So, and while they were dealing with traumatic, difficult cases, hostile reactions from people like parents who felt that this was a private family matter and they didn't want activists to be interfering in this private family matter, even though there was so much violence against the member of the family. So while activists are going through all of that, at the same time, participants in the study said that they worked for organizations with limited resources who could not provide mental health supports to their staff. So there was no space to process traumatic cases. There was no space for LGBTIQ people to deal with what they were facing because of transphobia and homophobia. Sometimes they were out in their organization, sometimes they were not out in the organization. So there was this difficulty that they were dealing with without support. So the question that I have for you is, did you come across this in your own work? And how did you deal with it? What help was available to you, for instance, when you had to deal with these kinds of situations? Please limit your responses, if you can, to 3 minutes.
Yes. So I identify myself as an indigenous person, woman with disability. And when I first came into the queer movement, let alone the conservative government, when I first came into the queer movement, I was seen as the other. To come to the mainland, it becomes very difficult. So I'm seen as the other, and Delhi is seen as the mainland. So the entire queer movement found it difficult to have a leader who is indigenous and who does not speak the English the way they do. You know, it was actually it is still upper class and upper caste. In terms of conservative governments, parents and conservative governments are always come together. So in a rescue operations, police have no say in matters where we decide, where we go by the law and rescue, LGBT people. So in cases where we have rescued LGBT people, parents have filed, criminal cases against us. We have been where we had to go to the court, and we still don't know what is the status of our criminal cases in one state, because that state police refused to come to before the High Court of Delhi. There are cases where, because of lack of shelter homes, I have myself kept people at my home during the interim period where we were waiting for the judgments to come. My parents have come and destroyed properties at our homes, and the police says, why will the parents think bad about the children? You should let the child go back to the parents, and we have to constantly say that they're adults, they're above 18 and they can take decisions, and it's a constitutional right. We always go by the constitutional right. And what happens is that because of conservative government, we do not have good laws, protecting LGBTQI people. Therefore, the police also have a say. Sometimes we have good laws, but the police also supports the parents' attitudes and the government attitudes against LGBTQI people, and it becomes very difficult for people like us who are human rights defenders and supporting the community and who are queer persons themselves. So, and because they say that because you are like this, therefore you are making our daughters like this, they have called us witches. They have called us, I don't know what names, I can't even tell you. But this is what happens.
Thank you, Ritu. Eka?
Pemerintahan yang konservatif di Indonesia, banyak sekali aparat yang sebenarnya kami tidak ada undang-undang yang secara rinci membedakan kelompok minoritas, berdasarkan apapun. Tapi dalam implementasinya seringkali kebijakan-kebijakan ini kemudian tidak dipenuhi oleh pemerintah. Mereka menjalankan kebijakan-kebijakan yang justru diskriminatif. Dan permasalahan lainnya adalah I'm a part of community. Jadi ketika melakukan advokasi, mendengarkan, kita membayangkan situasi yang sudah sangat susah untuk membela kelompok minoritas apapun itu. Kemudian mereka tidak mengetahui identitasku, dan ketika mereka mengetahui identitasku itu akan sangat berbahaya. Jokes selama advokasi yang penuh dengan stigma, penuh dengan diskriminatif, itu harus aku dengarkan. Itu harus aku senyumi, begitu harus aku maklumi di saat itu. Dan ketika aku akan sangat reaktif, ini justru tidak akan baik untuk advokasi yang dilakukan. Pendekatan secara perlahan harus dilakukan seperti itu, dan memang kita tidak bisa melakukannya secara konfrontatif, dan pendekatan secara pelan-pelan pun itu membutuhkan waktu yang sangat lama. Jadi situasinya sendiri ini belum menjamin hak-hak asasi semua orang, terutama dari LGBTIQ. Kemudian karena mereka tidak mengetahui identitasku, justru diskriminatif ini pun menjadi double aku rasakan ketika melakukan pekerjaanku. Dan kemudian tidak hanya itu, bahkan beberapa teman senior yang sudah melakukan advokasi ataupun pekerjaan hak asasi manusia jauh melebihi aku, dan dia sangat aktif membela korban-korban, tidak hanya terkait isu LGBTIQ, tapi korban pelanggaran HAM berat yang lain. Dan ketika dia membuka dirinya bahwa dia adalah part of community, kemudian apa yang dia dapatkan? Dia mendapatkan perlakuan diskriminatif dari korban yang dia bela. Ini situasi yang sangat stressful, yang kadang membuat aku berpikir, aku tidak akan pernah membuka identitasku, it's not safe for me. Ya, aku memang bekerja di dalam kloset, tapi ini yang bisa aku lakukan, karena dengan begitu aku masih bisa berkontribusi terhadap teman-teman komunitas, terhadap hak-hak orang yang lain yang bisa aku perjuangkan tanpa harus membuka sebenarnya identitas aku apa. Dan bahkan penolakan itu tidak hanya dari korban ya, dari kelompok keagamaan sendiri, bagaimana mereka tidak menyetujui ketika kita melakukan advokasi hak-hak LGBTIQ. Ini memang secara langsung belum pernah aku alami, tapi ini dialami oleh beberapa rekan yang lain, di mana mereka juga datang dari background agama yang sangat kuat, dan kemudian ketika diketahui bahwa mereka memperjuangkan hak-hak LGBT, penolakan sangat kuat ini terjadi. Dan mungkin saja kalau keluarga aku mengetahui bahwa aku juga berjuang untuk hak-hak LGBT, mungkin mereka juga akan sangat marah padaku. Tapi ya situasinya seperti itu. Bahkan tidak hanya kepada government, aku pun tidak bisa membuka identitasku kepada keluargaku, even kepada kolegaku di mana aku bekerja di lembaga hak asasi manusia.
Right, and makes you vulnerable. Yeah. Jean?
I was thinking about how to describe Singapore. I think there's a lot of misconception about the country I come from. A lot of times when context is important. When people look at Singapore, they use a development lens. They're like, how can you not have human rights? How can you not have resources to organize? But the reality is that the government is conservative, and that we have lots of restrictive laws. So in this kind of context, in dilemma, how do we work to change policies, especially when it comes to gender-based violence? I think amongst many activists, we often talk about how we are under stresses from vertical attacks, which is from the government, and horizontal attacks, which is from your peers. So for an example, is like from us, we work with the government to change domestic violence laws, to draft up the recommendations to be gender neutral, meaning that gender is not incorporated into the legal language. But in the process of trying to work with the government to change these laws, we also face attacks from peers, from other civil society activists, like, why are we working with this government who has violated so many human rights? of people who live here. So, but the question for us is that, can LGBT people facing domestic violence wait? What is the do we wait for a perfect government before we try to change the laws? And what is the context of the political system in Singapore? We might not have any dual political diversity for the next 40, 50 years. So that kind of pressure and not understanding from other activists also created a lot of mental health pressures on us. A good example is that my volunteers and my staff would quit because they felt so deeply hurt and traumatized by the attacks from your peers that they feel like, what is the point? It's not worth it that I'm doing all this work, but yet I'm being criticized and attacked or call all kinds of names or using specific words to that can really hurt you. So so I think there's also a generational divide where I think a lot of younger activists saw their activism online, but the reality of policy negotiation is that you have to do it offline. And very often to reach the table takes work to study the policies, to write the recommendations. So Instagram activism is not equivalent to policy change. And I don't think I'm the only one saying this. Lots of activists have been talking about this phenomenon that we are all facing, and it's not healthy for the community. Yeah.
So I think the picture that I'm getting from what you all are saying, all of you, Ritu, Jean, and Eka, is that while you're in the fight, whether it is doing frontline responding, first responder activism, whether it's doing policy change work behind the scenes, or whether it is trying to navigate the tensions from within your own communities, whether it's your religious community or family, while doing this work, is that it places tremendous burdens on individual activists, organizations where individuals are working with the organizations. And I think that's one of the things that we want to do in this panel, is to look at how the wellness, the mental health, the mental well-being of activists working to prevent and protect people from violence is assaulted, compromised, takes tremendous inner resources to deal with these things when there are no existing mental health supports for individuals. So based on that, let me go to the next question, which is, activists in Asia, particularly the folks in the studies, said that there is an expectation that activists must be selfless. That's what activism is. You have to be selfless. Always prioritize the work. Always prioritize the needs of the community over your own needs. Now, this makes it very difficult to claim time and space for self-care, right? Because self-care is somehow considered selfish. So my question for you is, how do you practice self-care? How do you navigate between these expectations of selfless activism and centering wellness in the context of the work that you work in? If you could just take about 2 minutes each, please. Thank you.
I can start. So for me, actually, it was difficult for me to take a break personally, and I'm the greatest advocate of self-care. And it was difficult for me to take a break because, first of all, as a director, I was handling a lot of things, and also I felt that if I take a break, what will happen? Like, what if the organization crashes? So it was because of the policies that we have in our organizations, and also the colleagues that I work with are amazing. And also the culture that we have been managed to build. Now, when someone is on vacation or someone is on this thing, no one disturbs. So even if I try and talk to my colleague during vacation, like one of my colleagues, I tried to say that, did you work on this? And he said, you're on vacation, you just need to switch off your phone and just relax. That's what and he's very junior. And that's what he told, because the culture we've been able to build in our organization, it's a very small organization with very little funding. But this is actually what we do. We support each other. We have created buddy systems where, like people of similar hierarchies ask each other if they're okay, if they're hydrated enough. This is the first question people ask: are you hydrated enough? Because we feel that it's very important to take care of self. And even we have policies like bereavement leaves. Recently my dad passed away, and it was very difficult for me. And my entire staff, except, asking how am I doing, did not disturb me even for anything. The events were done without me being part of it. Collaborations were done without my senior activist, feminist activist gets very startled, like how a small organization could manage to do this, where they managed to do collaborations even without me being there, without me being taken decisions. So when I got many calls for support and crisis intervention, I just had to pass on the number of my colleague who did not even disturb me for any crisis intervention work. So I think we have to constantly talk about self-care and how self-care is linked to collective care. Because if I did not have that collective care within the organization, I would not have managed to survive even this long, in the time of grief or in the time of COVID. But this is what we do in our organization. Thank you.
Eka and Jean, if you want to share your how, because I think it's important for us to know how you do your self-care.
To be selfish. So that's my first response. But I really want to criticize this ethos of suffering amongst activists. We expect activists to suffer, and we often judge each other when we are taking care of ourselves. There's this judgment of why you're not suffering. Are you really an activist? And it happens a lot. So one thing that happened to me was many years ago when I decided to be a full-time activist. The very first thing I'm trying to make sure is that I got a mortgage and get my place. But immediately I see here activists making comments like, oh, you bought a small place for yourself. Then I'm like, yes, because I'm trying not to be homeless. I know that activists don't get a lot of money. So I really struggle with guilt and shame for a while, because they are shaming me because I'm not suffering enough like them. But I spent more than a decade in the corporate sector, so I have a little bit of savings. So I went to a self-care retreat. I'm sure some of you will know Lim Lam Chu, and I told her about it, this old feminist. I'm not sure whether she's lesbian, maybe. And she told me that we shouldn't let this expectation of suffering amongst activists to get to all of us, and we should keep practicing and questioning, why do we want each of us to suffer? This is something that I feel like we need to keep calling it out. Yeah.
Eka?
Ya, sebelum bekerja menjadi human rights educator, 3 tahun sebelumnya aku bekerja di korporasi. Jadi dengan harapan bekerja di human rights education, human rights field, ini bekerja untuk korban, bekerja untuk komunitas. Aku total di sana. Dan aku memiliki latar belakang trauma pelecehan seksual, kemudian dengan berbagai identitas minoritas aku yang berlapis, ini membuat aku ternyata drain, ternyata kelelahan. Aku mengalami stres, aku mengalami perubahan pribadi. Dari seseorang yang sangat ceria, aku menjadi sangat mudah marah ketika sudah sekitar 7 tahun ya menjalani bekerja di lembaga saat ini. Aku menjadi orang yang berbeda, aku terserap energiku, terserap spiritku berjuang ketika aku hanya mengutamakan kepentingan korban, kepentingan komunitas. Dengan segala situasi konservatisme yang ada di sini, yang harus aku hadapi dan sebagainya. Kemudian di tahun 2019 aku berkata cukup, aku harus melakukan sesuatu untuk diriku sendiri supaya aku tetap bisa mengerjakan apa yang aku kerjakan saat ini. Jadi aku mengambil kuliah dan sangat spesifik untuk psikologi, sains. Aku ingin sekali mendalami apa sebenarnya yang terjadi pada diriku. Jadi aku tidak pergi ke psikolog atau psikiater, tapi aku pergi bersekolah untuk menemukan apa yang sebenarnya terjadi pada diriku. Dan ketika aku membaca banyak jurnal, aku mengetahui bahwa ternyata banyak sekali dampak-dampak ketika kita menolong sesama, ketika kita memiliki profesi untuk menolong sesama, mulai dari burnout, vicarious trauma, secondary trauma, bahkan sampai compassion fatigue. Dan aku merasa aku mengalami ini semua begitu. Dan kemudian aku juga menemukan sebuah artikel yang berkata soal sebuah jurnal yang membahas soal apa sih self care dan kenapa penting bagi kita aktivis ini. Di artikel tersebut ditulis oleh Merlinda Weinberg, di mana dia juga melakukan penelitian kepada aktivis-aktivis lainnya, dan di sana dia juga menemukan hal yang sama. Banyak sekali yang mengalami perubahan kepribadian karena aktivitas yang mereka lakukan dan mereka tidak melakukan perawatan kepada dirinya, sehingga mereka akhirnya energinya terabsorb gitu ya. Sehingga dari berbagai artikel-artikel ini aku berusaha mengobati diriku sendiri karena anak-anak yang belajar psikologi biasanya dikatakan adalah anak-anak yang sedang berobat jalan. Jadi aku kemudian memutuskan aku harus mulai merawat diriku. Jadi ketika pandemi ini adalah sebuah titik balik buatku. Aku mulai meditasi, aku mulai makan sehat, kemudian aku mulai olahraga. Dan ini benar-benar membuat diriku sangat berbeda. Diriku yang lama, yang penuh dengan semangat, yang ceria, ini aku peroleh kembali. Dan kalau sekarang ini mungkin aku agak cabi, ini berarti aku sedang burn out lagi. Dan aku perlu berarti meningkatkan self care lagi. Tapi itu satu hal yang penting, self care perlu kita lakukan supaya kita masih bisa menolong teman-teman kita yang lain, orang-orang di komunitas dan meneruskan pekerjaan kita.
Thank you for that, Eka. Jean, please jump in.
Oh, I think it's I was just thinking like a good analogy would be like when we're all taking a plane, then there's always this announcement, or in case of emergency, the oxygen mask will drop. The very first thing they tell you is put the mask on yourself first before you can try to help other people. And I think that's so true when it comes to self-care. If you don't have oxygen, why be taking care of other people? So be totally selfish, take the oxygen, do your pedicure, put your pictures on Facebook, show it off to people. It's like, yeah, I'm being selfish so that I can run the long race.
Thank you, Jean. So since we have started talking about, taking care of self, Eka talked about reading journals, Ritu talked about self-care and the kind of support from within her organization that felt really gave confidence that work can continue even when she was unable to due to bereavement. And Jean talks about the kind of guilt and shaming that takes place, which may be inadvertent, but has tremendous impact on individual activists. So the question, I guess, now is, it is difficult to get psychosocial support. It is difficult to get mental health services for activists, particularly activists who are working on gender-based violence, because in my experience, right, many of the activists I know who are working on gender-based violence are themselves survivors. They're survivors of family violence, they're survivors of childhood sexual abuse, they're survivors of partner violence. So there are possibilities when they may be triggered in the work that they're doing. But it is very difficult to get mental health care, either because there is no LGBTIQ affirming mental health services, or even if there are counselors who are LGBTIQ affirmative, they're not affordable for individual activists, or the providers are located really far away, or maybe some mental health professionals have breached confidentiality. and activists just don't feel safe going to them. So given some of these challenges and barriers to getting the kinds of support that we need, what do you think, how can alliances between mental health professionals and LGBTIQ activists working on gender-based violence be strengthened?
Yeah. So first of all, we need to destigmatize mental health, right? So as a director of an organization, when I came out as having mental illness, I have bipolar disorder, I have CPTSD, things like that. When I'm undergoing therapy, trauma-informed therapy on a regular basis, I take psychiatric medicine every day. So I openly talk about my mental illness to people, and within my organization and within this thing. So I feel that has also given us support to my colleagues, to people I work with, to talk about mental wellness. So almost all my colleagues are taking mental health support. We have we've also been, one thing that I realized that after taking trauma-informed counseling, that queer affirmative practice is also important, but trauma-informed counseling is very important because all the queer people have faced some sort of trauma in their lives, and only queer affirmative therapy will not help if they are not trauma-informed. And this is what I have realized from my personal experience, and this is absolutely true. Because this is how it's helping me, and other colleagues of mine. After I've started taking therapy, are also taking therapy, feeling confident about taking therapy. We also provide money at the end of the year for anything they wish to do. And also we have counselors, we have mental health professionals who provide free counseling to LGBTQI people who cannot afford this thing, because it's very expensive. So we have been able to maintain that system for at least 3 to 4 years now, that we are providing free proper regular mental health counseling to LGBTQI clients, where we also provide things like listening circles, art-based therapy to also our residents of the safe homes, and also from the livelihood center. So we have been able to talk about mental health in a way, mental well-being in a way which is destigmatized. And we've been also able, through those two counselors, we've been also able to build network of counselors who are supportive of queer people. Yeah.
Thank you. We have 10 minutes. So, and we have one last question that I would like to ask so that we can wrap up our discussion. So Jean, talk a little bit about this.
My answer is a little bit different from Ritu. I mean, Singapore is a really small place. Personally, for my group, we've collected 60 LGBT-friendly therapists and counselors, but I don't go to any of them. There are two reasons. One is security issue. I don't feel safe sharing with any of these 60 persons because Singapore is a small place. I don't want any kind of data, information, or vulnerability of me to be out there. And secondly, like what Ritu say, a lot of counselors and therapists and social service trained, they very often they have absolutely no idea what they're talking about when it comes to LGBT gender-based violence. There's a huge lack of expertise. So whatever therapy session will just end up with me pointing out all the holes that they are talking about. So it doesn't work for me. So I think one of the solutions that me and some of the leaders or EDs in the Southeast Asia region is like we're starting to form a support group for people to support each other. So it doesn't have to be restricted in your country, with a facilitator or coach that has experience to facilitate this support group once every month, once every 2 weeks or once every month. Yeah.
Eka.
Iya, di sini kita memang ada layanan kesehatan mental yang ramah untuk teman-teman LGBTIQ, untuk saya gitu ya. Tapi memang ini berbayar, tidak disediakan oleh instansi. begitu. Dan layanan ini memang tidak mudah diakses oleh teman-teman komunitas karena harus berbayar. Jadi menurutku memang penting adanya sebuah wadah supaya kita bisa saling menguatkan, sebuah konseling begitu ya, saling menguatkan, atau hanya tempat berbagi cerita di antara kita menghadapi dinamika perjuangan hak asasi manusia yang sedang kita lakukan. Karena kalau di sini meskipun seperti pengalaman Jin sebenarnya, ketika aku mengakses layanan yang ramah dengan LGBTIQ pun masih ada kekhawatiran apakah nanti dataku akan digunakan, apakah disampaikan dan sebagainya. Kekhawatiran itu masih melekat. Jadi aku akan sangat selektif sekali mengakses layanan-layanan yang seperti ini, dan aku lebih memilih sebenarnya bercerita kepada teman. Dan aku sangat selektif sekali sekarang melakukan pembatasan kepada teman, hanya benar-benar circle yang sangat kecil yang aku percayai untuk mendengarkan keluh kesah aku. Paling tidak ketika aku didengarkan itu aku sudah merasa lebih baik. Dan ini pastinya juga dibutuhkan oleh teman-teman yang lain. Jadi memang kita memerlukan sebuah wadah untuk saling berbagi cerita. Jadi aku setuju sekali ketika kalau Jin bilang kita harus mengembangkan sebuah wadah seperti itu di Asia yang cross country. Terima kasih.
Now, listening to you all, I feel very emotional actually. So thank you for being so candid. So to wrap up our discussion, let's do a lightning round of responses. And in 30 seconds, not 30 minutes, 30 seconds or less, here's the question for you. What would you recommend for self-care in activism to be a radical practice? Now, this is a whole workshop, it can take 2 hours, but in 30 seconds, what would you recommend in order for self-care in activism to be a radical practice?
Can I go first? I think, especially for LGBTQ individuals, self-care is we need to get rid of self-care is often linked to selflessness, because patriarchy requires us to be selfless and constantly giving. So we need to beat the patriarchy that frames the issue around selflessness and self-care. Very important.
For me, I think the radical practice, first of all, would be to just be okay to be vulnerable. The fact that we are all vulnerable, we can all make mistakes. I think this is the first thing, because we're all taught to be perfect. You know, this whole idea of I'm the perfect feminist, we are all not perfect. I think this is the first thing we need to understand. The second thing I would definitely talk about is collective care. You know, self-care without collective care is impossible. So these are the two things that I want to talk.
Eka?
Ya, aku setuju dengan Ritu bahwa kita bukan manusia yang sempurna dan tidak ada salahnya kita mengambil waktu untuk merawat diri kita sendiri, karena tanpa merawat diri kita sendiri kita tidak akan bisa membantu yang lain. Dan kita juga tentunya perlu saling menjaga komunitas kita supaya semakin kuat dalam melakukan advokasi.
Well, this prompts me to ask 2 follow-up questions. Well, actually make one comment. You know, Audre Lorde, who is a Black feminist, lesbian feminist, civil rights activist, who I respect a lot in her work and who she is and so on. Audre Lorde said, caring for myself is not self-indulgent, it is self-preservation. And that is an act of political warfare. And I really believe that. But I want to pick up on what Ritu said about collective care. The concept of collective care, you know, developing mechanisms of collective care as an alternative to provide supports and for sustainability of activism. My question is, how do we ensure accountability so that no harm is committed?
Yeah. See, I come from an indigenous village where I have always seen collective and community care. I cannot imagine life without community care. So for instance, and self-care is sometimes easier. For instance, corporates would give, money to people, say that go and take care of self. But collective care means overhauling the system. It means equal pay. It means respect. It means, it means diversity and inclusion. It means so many policy changes. Therefore, collective care is not taken care of as important. And collective care sometimes is also not quantifiable. Self-care is like you have given 20 beauty passes to women, but collective care means actually challenging the entire system and taking care of the system. And if the system is actually, the policies are such that you are accountable, all of us are accountable, I think we would be able to make that change with collective care. It's not that difficult.
Okay, so on that note, let's go to the Q&A and see what we have. Let's see, are there any questions? I don't see any questions. So let me ask a question because I think it's important for us to address one thing that came up in your questions. Now, in India in 2018, Singapore in 2022, consensual same-sex relations was decriminalized. In Indonesia, as recently as December 6, there was passage of a revised criminal code that criminalizes extramarital sex and cohabiting couples, including same-sex couples, and a whole host of other things. So how have these kinds of changes, at the national level, how do they affect individual activists at the same time, at the national level, but also activists who are working to stop violence against LGBTIQ people? Because we know that in places where there is decriminalization, do we assume that violence goes down? And in places where there's now criminalization, do we assume that violence is going to go up? And how is that affecting activism?
We also have the Trans Act, Transgender Persons Protection of Rights Act. I think the best thing with these laws is that we are able to go to the police and we are able to go to the judiciary and can say that, see, we have these rights and please implement these rights. So even if the families are against us, the police are against us, we can just take the constitutional route and the legal route and support each other. I think these laws and judgments are very, very useful for us.
Anybody else want to speak to this? Eka, you want to talk about the Indonesia situation?
RKUHP itu memecah perjuangan dua kelompok yang konservatif dengan pro human rights. Ini adalah perjuangan yang sangat melelahkan dan tidak hanya ketika kita sedang berjuang, itu keselamatan kita juga sangat terancam. Tidak hanya yang berasal dari komunitas LGBTIQ, tapi orang-orang juga teman-teman kita, ally kita yang memperjuangkan hak-hak LGBTIQ. Jadi, tapi ini memang harus dilakukan terus-menerus. Kita tetap harus memperjuangkannya dengan cara apapun, dengan tentunya meminta bantuan, dengan konsolidasi dan sebagainya. Saat ini kondisi di kami memang mengalami kemunduran dalam perjuangan hak-hak kelompok LGBTIQ, perjuangan kita. Tapi tentu saja kita tidak boleh menyerah. Apapun kita gunakan cara advokasi untuk terus memperjuangkan ini. Karena di sini benar-benar terpecah. Ada di satu sisi secara nasional yang sangat mencoba mengkriminalisasi kita, mengancam kita, tapi ada juga beberapa daerah yang sudah mulai terbuka dan bisa menerima. Jadi ini perlu kami upayakan terus-menerus di sini dengan berbagai pendekatan tentunya.
Jean, do you want to have the last word?
I think over the last year, when the repeal was happening, we were negotiating for it. So there's a lot of mental health stresses because it was a roller coaster ride with the backdoor negotiations. But now that it's been repealed, we can see that the religious groups are organizing for battle, and you can see them. I think that at the back of our minds, even though we're celebrating, but we're also watching what they're doing, and I think the road ahead will be tough for us as well.
I just want to make a note that, here we are in a professional setting, doing OutSummit, sharing, our thoughts, and Ritu's cat is there on screen as well. I love it. I love it because it's like talking about self-care, talking about sustainability of activism, and we have our animal companions right there. We're not in a corporate setting, or maybe even in a corporate setting. Why not have our dogs and cats with us? So time has flown, and I want to thank everybody. It's a privilege to know you. It's a real honor to hear about your work. And thank you for being so candid in what you have shared. I think we definitely need to change the cultures of activism that deprioritize self-care. And secondly, funding is definitely needed for long-term support of mental health and well-being so that individual, organizational, and movement wellness can be supported while we are striving to prevent and protect LGBTIQ people from gender-based violence. So on that note, thank you to everybody, all of you. I'm so glad that we'll continue to work together. And thank you to the audience who's here. And I think over to Jennifer now.
Hello, everybody. Thank you so much. Thanks to our panelists and Grace. It's so touching. It was very touching, and I'm very happy we do have this session. So for someone who might not know me, I'm Jennifer Liu. I'm the new director for Asia program at Outright International. So today, it's the last day of OutSummit Asia, and also the last day of we have a whole week of OutSummit. I'm so excited. And also for today, we understand more about Taiwan, Nepal, Philippines, elders, LGBT community, from internal understanding to external policy making, advocacy. I think all of them are very important. The second one, the self-care issues, actually, I didn't pay a lot of attention on that, like a lot of activists in the region. But I think it's very important to start to talk about that, to change the dynamic. And so today, I know our panelists provide some very good strategy and advice. I hope that that is very helpful for you, because fighting for equality, creating change needs a long-term investment, and also we need more sustainable movement. But we have to remember, we are here, speak out for those people who cannot speak by themselves. So remember, here we are very privileged to have this platform and have the capacity and ability to speak out. But I also want to invite all of you to be solidarity for our community on the ground. So also, I would like to invite you follow Outright on our social, Instagram, Facebook, Twitter, and LinkedIn. And also, I want to let you know our every session from Monday to today, Friday, we have a lot of amazing keynote and section and panels will be uploaded to our YouTube channel. So stay tuned and also make sure don't miss out anything. So I hope we can all see you next year, maybe in person or still online. It's also fine. So I also want to share one of very important our value, which is together for better LGBTIQ lives. Outright. I hope enjoying our OutSummit and OutSummit Asia. See you next year. Bye-bye.